Hi guys, this is Tiffany Vo here, and I have a master's in public health. You might know me because I may have responded to you on Dr. Sadeghi's Instagram. So we are here today to answer some of your best submitted questions to Dr. Sadeghi. So here we go. Dr. Sadeghi, one of the questions is, I've felt as though I've been experiencing thyroid symptoms while blood levels show normal, whatever that is. I get painfully bloated to the point of getting months pregnant more often than none lately, despite how healthy of a plant-based whole food diet I've been eating. Your thoughts?
So she is eating a healthy whole food plant-based diet, which is great. A whole food plant-based diet is rich in prebiotic-rich foods, which diversify the gut microbiome, which is of course healthy for the GI tract. So I have no problem with that. What I do have a problem with is if she has SIBO, she can't just eat a whole food plant-based diet and expect the SIBO to go away. SIBO, which is the over-inoculation or overgrowth of bacteria in the small bowel, where it doesn't belong, doesn't just resolve on its own with diet alone. Sometimes one needs to have antimicrobial or antibiotic therapy to get rid of SIBO. So although she's eating healthy, she may be having a hard time getting rid of the SIBO.
Another one of your followers, Kaylee Lover, 2 R's, says, my stomach burns constantly no matter how many fruits and veggies I eat, sad face. I cut out gluten, dairy, and meat, and it still hurts. Gastros throw pills at me, and I refuse to take them. They just say too much stomach acid, but they don't tell me why. Help!
All right, well, there is a condition called Zollinger-Ellison syndrome where there is too much stomach acid. I'm assuming that her doctors have looked into that. But also there are different causes of stomach burning, and it's not always due to too much acid. It could be, sometimes you can have dyspepsia, which is a general term used for stomach burning. And so, it's very hard for me to answer that question on Instagram without knowing what else is going on, without talking to her and getting a detailed history, looking at her laboratory values, doing an exam, doing some radiological studies. But it just seems like perhaps she needs to get a very good, thorough evaluation by somebody she trusts, and so she knows once and for all why her stomach's burning.
On that note, would she be able to make an appointment with you?
Yes, so she could contact me on telehealth, and she would have to go on www.drangiehealth.com to make an appointment.
Okay, awesome. Another question from a follower, plants and yoga. Thank you so much, but what could be the cause of still having symptoms like slow digestion, fatigue, dry skin, poor hair, or cold intolerance, but according to the blood tests, TSH, the hormone levels are okay? I've been treated for hypothyroidism for 20 years now, but the symptoms have always been there, no matter what.
Well, one of the biggest mistakes people make is they go by the TSH. TSH is a good screening test to screen the population for hypo or hyperthyroidism, but it's definitely not a good test to determine how well the thyroid is, the status of the thyroid in the blood. So two better tests to go by are free T3 and free T4. The other thing is that many doctors put their patients on levothyroxine or T4 without the addition of T3, and some people don't do very well with that. So in order to optimize them, in particular when it comes to the GI tract, it's really important to do T4 and T3 treatment in combination, and people do much better than just having a large dose of T4. So if she's still symptomatic, I don't really care what the TSH says, or I don't care what the T4 says. You have to first treat clinical symptoms and then treat numbers, so the clinical symptoms are more important. And so it sounds like she may not be well optimized. She may need more medicine. She may need to have her dose adjusted. Again, she's one who should probably make an appointment with an endocrinologist or myself. It doesn't matter, but she needs to have that evaluated in detail.
And you said optimization. That's something you do speak about in Trifecta of Health, right?
I do. It's a lot of doctors, or traditionally in medicine, we treat numbers, and we treat basically we try to keep things within a normal range. But in my practice, I've really learned that you can't do that because people are different. Everyone's different, and if you just normalize the number, people don't necessarily do well. You have to optimize it. For example, when you see a thyroid range, it could be from 2 to 4. And, if you look at the thyroid range for a lot of the very young people, the thyroid range could be in the 3s and the 4s. But when you look at the thyroid range for the elderly, that could be in the low 2s. So when I mention optimization, I mean taking the thyroid level to a more youthful level. Basically based on how the patient feels, but not based on what the actual number is.
All right, so another question is, I'm having a hard time saying this, so I'm going to skip the name. Very interesting. I'm curious if you know of an estrogen hormone corrector for GERD. I read a research where doctors found differences between GERD symptoms in women and men, and they think it might be related to hormones. I've also seen some comments on the internet from women who said that GERD symptoms improved or even totally disappeared, often as a side effect of their hormone therapy. Though I haven't had time to find any scientific papers on it yet, do you know of anything out about this relationship? Thank you.
Well, there is some relationship between worsening of reflux or developing reflux when there is an imbalance of hormones, or, for example, during pregnancy, when there are elevated levels of estrogen and progesterone. So many women do well until they get pregnant, and then they suddenly get reflux disease or have heartburn. And one could blame the hormone changes because obviously prior to getting pregnant, they were doing well, and their pregnancy is not advanced enough for the physical pushing of the belly onto the stomach. So hormones probably have something to do with it, and it's probably because the progesterone hormone, for example, can relax the lower esophageal sphincter and allow the reflux state to go up. But again, if you have a hormonal imbalance, she doesn't seem like she's pregnant. If she has a hormonal imbalance, she should address that. And I really do believe in bioidentical hormone replacement therapy, where women take their hormone levels and they take it to more of a youthful level, okay? We don't have to have hormone levels of a 25-year-old when we're 65 or 45. But we can basically use bioidentical hormones to our advantage to take our levels to more of a youthful level and use the minimal effective dose. So I'm definitely a big believer that if you're, if you have hormone deficiencies, fix it. There's really no reason to suffer and have problems. You should fix it. And if you use bioidentical hormones rather than synthetic hormones, you're relatively safe because this is not the same risk as far as developing cancer.
Thank you so much, Dr. Sadeghi, for answering some of the best questions that you guys have submitted. If you guys have additional questions, remember you can make 30-minute telehealth appointment with Dr. Sadeghi on www.drangiehealth.com. And if you'd like to learn more about hormone optimization, your diet, and exercise, then you can purchase Trifecta of Health on Amazon today. Thank you so much, Dr. Angie Sadeghi, and
#Dr. Angie Sadeghi.